know that you've done really cool faces. I know you from DZ Zintle, but you don't just do just Botox. You do quite a lot of things, especially skin.
So I do a lot of things. So remember, aesthetics is not just the big B. It's not just Botox or fillers or all the things people are scared of.
Yeah.
It's also skin treatments. It's also anti-aging. So a lot of where we don't do Botox and fillers, we just kind of give you a better skin, a better glow. Also, we don't want all those wrinkles like our grandparents had when they were older. So we try and avoid those kind of things. So that's quite nice. So let me give you a rundown. So we do skin. Skin is divided into 6 layers. So we're going to do the top of the skin. So that's skincare products. It's going to be treatment on the skin. So chemical peels, micro needling. I'm sure we've all heard about the salmon facial that everyone in Hollywood's doing at the moment. It's stunning. It's a very nice facial.
I've done it, but it wasn't the injection one. Can we inject it? Is it legal to inject it?
So the salmon sperm facial is actually an injection. So if you've done something, it's something different. It's actually an exosome. So it's the DNA of a salmon sperm that they make into a serum that we inject into the skin that gives you elastin and collagen stimulation and also a very good glow. So that's the one that's trending in Hollywood at the moment. Then we have the next layer where we go into elastin and collagen stimulation. So that would be more lasers, radio frequency. So lasers where we're talking about tightening and firming. Radio frequency is more like a hot stone massage, but a bit more intense because it's giving you a kind of a treatment into your skin. And then the last one is where we do injectables. So that's where the big B comes in. Botox is something people are starting a lot younger nowadays, so like 24, 25. But it's not a taboo anymore. So when I started in aesthetics 15 odd years ago, nobody spoke about it. So the clinic was more like people who knew and they would come. Now it's based on word of mouth. Before, nobody told anyone. It was such a secret. Oh my God, it was scary.
Yeah.
You would walk past people and they would just ignore you. Like, oh my God, we don't even know who she is, which was interesting. And now it's different.
Considering that you are the reason they glow and they're
exactly.
just like,
yeah, but now it's different. And also it's a good thing. Because the more we talk about it, the more we know where to draw the line, where we must, don't do certain things, like don't overfill, don't over Botox. You don't want to have, that totally, as they call the RBF. Definitely don't want that, the resting V face. You actually want your face to move. You want to have expression. But at the same time, you don't want to look aged, So there's so many nice things that you can do. People think it's very costly.
Yes.
I must say, initially when it came out in South Africa, it was because there were so few people doing it. There wasn't really competition in the market, if you know what I'm saying. Now it's readily available. The prices have come down significantly. It's very much available to everyone. It's not just for celebrities, normal people who working. Everyone wants the glow. Everyone wants to look nice. We also all in this phase where we want to go more natural, so less makeup. We want to have good skin. We want to be able to not contour so much to look heavy, more natural, more light. So all of these treatments help you with that. You actually get a more natural contour to your face. You get less foundation, less powder, those kind of things. You could actually just do a BB cream, which is great. That's what I think we all want to achieve in life.
What is a BB cream, doctor?
Oh, a BB cream is a very light foundation. So it's more like a sunblock with a little bit of a tint.
Oh, okay.
So we don't do excessive amounts of foundation. So we just want to get everyone to that natural space. But having said that, we also do a lot of acne young kids with a lot of acne, and that affects their confidence. It affects them going to school. We are all aware of the bullying that goes on, and it always starts around 13, 14 when they're hitting puberty. All the hormones start changing, and the acne flares up. So also do a lot of that. Adult acne is a big thing. So we have a lot of sort of, I would say 43, 44-year-olds that have never had, a pimple in their life, and suddenly they've got this face of acne. So that's also a big thing. But it's more also a holistic approach, right? You want to have clear skin. You want to have a glow. You want to be able to get up and go. We're living longer, right? So the mortality rate across the world has increased to like 75, 80.
Oh.
So we have to look after, before it was about 65, 70, it's now increased. So we have to remember, we only have one skin. It can't change. So we have to look after it, basically.
Okay, so you're saying it's no longer a taboo. So I'm just curious. There are people that I've seen and I really wanted to ask, like, have you done it? Because sometimes it's very visible. And I still feel like, hey, it's none of my business. I shouldn't. But I'm thinking, now that you're saying it's no longer a taboo, I'm going to ask, like, have you done it?
The thing is sometimes we're appreciating how good you look.
Yeah.
Have you had something done? You're looking really good. I'm naive to this area. Please tell me if you have or not. You know what I'm saying? But remember, it's always a combination of things. So it will be a bit of treatment. So injectables like the big B fillers. It's going to be biostimulators, which is trending like you cannot believe. So they are actually injectables which don't give you that pillow face. Many years ago, people had so much of filler in their faces, you could actually like pop it with a pin. It was so big.
I find like people are still overdoing now, doctor. I mean, I've seen things.
There are some people, and I must say, I think it's our responsibility to tell them they're looking strange.
I don't know if I can do that, but no, because they're making us, people who haven't done these things, be scared because you're like, I don't want to look like that.
I don't want to look like that. Correct. So the best way is to look at your doctor.
Yeah.
If your doctor looks weird, you are going to look weird because that is normal for them. You have to, and also look at the work they've done. Look at people they've done. Look at people they've treated. That's very important, to also go to an experienced injector, someone who's done it for a long time, and also someone who's going to be able to say to you, look, enough is enough. Like, you've got enough in your face now. You can't actually put more, to be honest. And there are people who don't have that moral compass, and it's all about, no problem. You want more, I'll put more for you.
Yeah. All right,
so
and do you also do reversals, doctor? If I have had a job and it didn't turn out the way it was intended to, do you do reversals?
So let's just discuss that for a minute. So we do everything that's non-surgical. Okay, so we don't do anything that's invasive. When it comes to Botox or neuromuscular blockers, it cannot be reversed. So it lasts for 3 months.
So you must wait for it.
You have to wait for it to wear off. After 3 months, it goes away on its own.
Even if it's botched.
So look, Botox is very rarely botched. Because if, for example, one eyebrow is high and one eyebrow is low, we can balance it out. So we will inject another muscle on the other side to even it out. Also, Botox or neuromuscular blockers get botched when the patient doesn't do the aftercare. So you'll say to them, no lying down for the next 3 hours, no gym, no sauna. You give them a whole list of things, and they are non-compliant. Yeah. So then what happens is that the Botox actually moves. So where we put it and you go and lie down, it moves from the place we've put it in.
Yeah.
But that's one where we can actually inject another muscle, even it out. But if it's really botched, as you say, you have to wait 3 months and it will wear off on its own.
Yeah.
If we talk about filler, so filler is where we do big lips, big cheeks, big chin, those kind of things, yes, it can be reversed. So we actually inject another product which dissolves the filler. Having said that, it's not a procedure without side effect or pain or anything like that. But yes, it can be. But there are some people, and it's happening a lot now, where they are buying things off Amazon, Alibaba, I don't know.
They're buying injectables.
They're buying injectables because remember, in other countries, it's not regulated.
You can buy injectables
online. You can buy injectables online. And what they do is they go to like nurse injectors, so not a doctor. And they're injecting so there are some fillers that cannot be reversed. So those are calcium fillers. Once it's in there, it's in there. It doesn't come out. So it's personally, I don't do things that can't be fixed. So I don't do permanent fillers. And I've been doing this for like 15 years now. And I still don't do permanent fillers.
I didn't even know there was such a thing as permanent fillers.
Yeah, so those are the ones that can't be dissolved. So it doesn't matter what you put in there, you can't break it down. Like you can't dissolve it. And that is a thing.
But already just thinking about it is scary because you end up having this hard layer, right? Because it's like frozen.
So those obviously cannot be reversed. But like for the most part in South Africa, it's very regulated. There's only doctors that can do it. It's not like we're watching in the US, where you can have anyone. I mean, in all my years, I've not seen an actual botched patient like you see on TV, to be honest, in our setting, which is great. But it is a global world and the world is changing very rapidly. So it may be coming to us sooner than we think. We don't know.
I hope not. Doctor, do you also fix scars? Let's say I had a bit of an accident and then I'm left with a permanent scar. Do you also do scars removal?
So we do scar revision. So scars can be revised. They can be, it depends on the scar, right? So if it's a very big scar, if it's something that requires surgery, I will refer you. If it's something that can be done in my rooms, then yes, most definitely. It's quite not intensive. It's a nice treatment. It's actually very rewarding because you get good results and the patients are happy. So that's also a nice treatment that we offer. We also do like red carpet facials. People are going to events. If you want your makeup to sit nice, we give you that sort of glow and plump where the makeup sits nicely onto your skin. But also it's just a nice space to be in. It's very rewarding. People are happy at the end of the day, which is nice.
I mean, I've seen Kelly Kumalo's face after they do that facial. I don't know what it's called because I need that. But
PRP.
Yeah, but you look at it like, how much money? How much money?
It's not that. Look, I must tell you, a lot of people will work within your budget. So if the prices, depending on the product that we use, depending on how much we're paying for a product, obviously we'll keep that in mind. But for the most part, most of my colleagues and people that I know, we always try and accommodate a budget. There's something for everyone. I mean, I can do a facial that costs 650 Rand. I can do a facial that costs 16,500 Rand. So there's really there's a huge range. And in that range, you can accommodate everybody, and it's not just for the rich and famous anymore. I mean, like I said, the market is competitive. There's lots of people offering it. It's not as exclusive as it was 15 years ago. So it's very, affordable.
Okay. So now that everybody has heard that it's not just for like celebrities only also.
No, not at all.
People look at these things and are like, it's for celebrities and because they get discounts, I can't afford it.
Well, we're hoping nobody's getting a discount anymore. But no, it's very affordable. I'd just like to let all the listeners out there know that it's not something to be scared about. It's also a process that needs to be eased into. So one thing at a time, slowly. We start with your skin and then we'll work up from there. also will work into your budget and see, what you can afford. In aesthetics, this never used to happen before, but it does happen now. There'll be like Mother's Day specials, Valentine's Day, like what are the other ones? Black Friday, Women's Day. So there are, you can look out for those, and it's very much worth it for everybody,
All right, Doctor, thank you so much for educating us this morning. And I
hope I answered all your burning questions.
Yes, I wanted to know about why, like some people have, I think it's fillers, because I thought that was Botox, but it's fillers where they have this hard layer that looks like it's a rock.
Yes,
and
so
they
that's
look
filler.
very,
That's filler.
like swollen.
Weird.
Yeah, but Doctor, we've reached our time on the air. I have to conclude our chat here for today. Thank you so much for chatting to us.
Next time. Thank you for having me, and hopefully next time we'll answer all those questions.
Yes, absolutely.
Have a good day.
That's Dr. Fathima Bhabha, and that's it for this hour. It's 11 o'clock, so let's go straight to the news.